Taking blood pressure medication for a lifetime might actually be making your health weaker without you even realizing it. Dear friends, for most people, the moment they're told they have high blood pressure, the very first reaction is, I guess I'll have to take medicine for the rest of my life. But in reality, that's not entirely true for everyone. There are people who've been on medication for over 10 years, yet their blood pressure still isn't stable. And worse, they've developed new problems like insomnia, numb hands, aching knees, memory loss, or even kidney issues. If we truly understand the root cause of high blood pressure by taking care of our diet, exercising regularly, and managing our emotions, many of us could actually reduce our dosage or even stop relying on medication altogether. This video is here to help you stop being afraid, stop being dependent, and stop misunderstanding what high blood pressure really means. Because high blood pressure is not a life sentence. It's a signal from your body, asking you to make the right adjustments. Before we begin, tell me, how old are you? Where are you watching from? And how has your blood pressure been lately? Share in the comments so we can understand each other better. Now let's talk about the most common mistakes people make when dealing with high blood pressure. Mistakes that, once recognized early, could change everything. The first mistake many people make is believing that high blood pressure can't be cured and that they must take medication for the rest of their life. This belief is incredibly common, and it traps so many seniors in a cycle of fear and dependence. When the doctor says, you have high blood pressure and you'll need to take medication long term, many people misunderstand it as a life sentence. But the truth is very different. High blood pressure isn't an instant killer. It's a chronic imbalance, showing that your blood vessels, heart, kidneys, or nervous system are out of harmony. It's a signal, not a sentence. When the root causes, such as poor diet, chronic stress, lack of movement, water retention, or excess weight, are corrected, blood pressure can gradually return to normal without lifelong dependence on medication. In fact, countless people have experienced this transformation once they began eating more vegetables, practicing deep breathing, sleeping better, and reducing salt. Their blood pressure naturally went down. Some even had their dosage reduced by doctors after just 6 months. But here's the catch. If you keep eating salty foods, staying overweight, and avoiding exercise, your blood pressure won't drop. Instead, your doctor may have to increase your dosage or add new medications, which often means more side effects, like fatigue, dizziness, or swelling. And if you rely only on medication for years, the root imbalance remains, silently damaging your heart, brain, and kidneys, increasing your risk of stroke, heart attack, and kidney failure. So the goal isn't to quit medication overnight, it's to understand that pills only manage symptoms temporarily. The real, lasting solution lies in lifestyle correction, because not everyone with high blood pressure needs medication forever. When you give your body what it truly needs, it has an astonishing ability to heal and restore balance. Now let's move on to the second mistake. And this one is all about how people actually take their blood pressure medication. You might think taking a small pill every day is simple, but this is where many seniors unknowingly put their health at risk. One of the most common problems is not following the prescribed dosage. Some people skip doses when they feel fine, while others forget entirely. According to studies, nearly 50% of patients with chronic conditions do not take their medication as directed. It sounds harmless, missing a dose here and there, stopping the pill once you think your blood pressure is stable. But here's the truth. When you suddenly stop or take your medicine irregularly, your blood pressure can spike dangerously. That surge puts tremendous pressure on your heart and blood vessels, sharply raising the risk of a stroke or heart attack. Then there's another dangerous habit, adjusting your dosage on your own. Many older adults think, if I forgot one dose, I'll just take double next time, or my blood pressure's high today, I'll take an extra pill. It sounds logical, right? But it's one of the most serious mistakes you can make. This can cause your blood pressure to drop too low, too fast, leaving you dizzy, weak, or even fainting. Worse yet, if you accidentally take too much, for example, when you can't remember if you already took your morning dose and decide to take another just in case. Your total daily intake could double without realizing it. Your heart might struggle to keep up, leading to overdose symptoms and dangerous cardiovascular stress. On the flip side, some people do the opposite. They only take their medicine when their blood pressure feels high and stop once it seems normal again. This on and off pattern creates constant fluctuations in blood pressure, forcing the cardiovascular system to work harder every day. Doctors call this non-adherence, and it can completely undermine your treatment, making your medication far less effective and your risk of complications much higher. So what's the right approach? The golden rule is never self-adjust or skip your medication. Follow exactly what your doctor prescribes, the right dose, at the right time, every single day. Even missing a few pills can send your blood pressure soaring again, increasing your risk of stroke, heart failure, or aneurysm. And for those who often forget, there's a simple fix. Use a pill box labeled by day or set a daily reminder app on your phone. A small routine like this can literally save your life. Because when it comes to high blood pressure, consistency isn't just good practice, it's your strongest protection. The third mistake many people make is trying to force their blood pressure down to a perfect number. Have you ever felt anxious just looking at those two numbers on your blood pressure monitor? When it shows 140/90, you start to worry. When it's 130/85, you finally feel safe. But here's the truth. Those numbers don't always tell the full story about your actual health. The more we obsess over hitting a textbook perfect number, the more we risk disrupting the body's natural self-regulation. Take this example. An older adult whose blood pressure usually stays around 135 to 140/85 or 90 feels fine. No dizziness, no fatigue, sleeps well, and moves comfortably. But after hearing others say that 120/80 is the only healthy range, they push harder, sometimes even increasing medication to hit that number. And what happens next? Their blood pressure drops too low. They start feeling dizzy, weak, tired, and in some cases even experience fainting or kidney strain. The ideal blood pressure isn't a one-size-fits-all figure. It should depend on your age, body type, medical history, and daily lifestyle. For a younger person, yes, 120/80 might be optimal. But for someone over 60, maintaining around 130 to 140/85, as long as you feel clear-headed and stable, is perfectly healthy. What truly matters is stability, not perfection. A steady, balanced blood pressure that keeps your body comfortable and your mind alert is far more valuable than chasing an unrealistic ideal. So remember this, lower isn't always better. Don't become a prisoner of the numbers on the screen. Instead, listen to your body. If your blood pressure is slightly elevated but you feel strong, sleep well, and live normally, focus on natural adjustments first, like improving your diet, relaxing more, or exercising gently before rushing to increase your medication. Because true health isn't about chasing perfect numbers. It's about finding the balance that keeps your body alive, calm, and strong. Now let's move on to the second part of this video, a section that I believe will give you a clearer and deeper understanding of high blood pressure. In this part, we'll go through some of the most common questions people have about hypertension, questions that come up again and again in senior health communities and discussion groups. So make sure to listen carefully because your question might be right here. The first question is this: why does my blood pressure stay high even though I'm taking my medication every single day? This is something so many people ask. Doctor, I take my pills regularly, sometimes even 2 different kinds, but my blood pressure is still high. Does that mean my medicine isn't right for me, or is my condition too serious? Here's the honest truth. Medication alone is not enough. In many cases, blood pressure doesn't drop not because the medicine is weak, but because your body isn't ready to heal yet. There are 5 main reasons why medication fails to control blood pressure effectively. 1. Too much salt, often in hidden forms. You may not add salt directly, but you might still eat fish sauce, pickles, salted dishes, sausages, canned foods, or instant noodles. All of these contain high sodium, which makes your kidneys retain water and raises pressure in your arteries. 2. Lack of sleep or poor quality rest. When you sleep less than 6 hours a night or can't fall into deep sleep, your body produces too much cortisol, a hormone that tightens your blood vessels and causes your blood pressure to rise over time. 3. Chronic stress and worry. Many older adults say, "I don't have stress anymore. I'm retired." But stress doesn't just come from work. Worries about money, children, health, or loneliness all build up silently and lead to persistent high blood pressure. 4. Medication resistance. Sometimes the medicine simply no longer works well for your body after several years of use. When that happens, it's essential to see your doctor again to review and adjust your treatment plan before side effects worsen, or the drug loses effectiveness. 5. Underlying conditions, like belly fat, fatty liver, or diabetes. These chronic issues create inflammation inside your blood vessels, making it harder for any drug to fully do its job. To put it simply, the pill treats the symptom, not the cause. The real solution lies in your lifestyle, your diet, your sleep, your mindset, and your daily habits. If those remain unbalanced, then even if you take the right dose at the right time, your blood pressure can still stay high. Because at the end of the day, medicine controls, but lifestyle heals. The second question many people ask is what blood pressure level is considered dangerous? At first, this question sounds simple, but in reality, many people become obsessed with the numbers on their monitor. They measure their blood pressure several times a day, and the more they check, the more they worry. According to the latest guidelines from the World Health Organization, for healthy older adults, a normal blood pressure range is between 120 to 139 over 70 to 89 millimeters of mercury. Stage 1 hypertension is between 140 to 159 over 90 to 99 millimeters of mercury. Stage 2 hypertension means 160 over 100 millimeters of mercury or higher. But here's what truly matters. The numbers alone don't tell the full story. If your blood pressure is slightly high, but you have no symptoms, no headaches, no dizziness, no fatigue, it's often safe to simply monitor closely rather than immediately increasing your medication. On the other hand, even if your reading is only 135 over 85, but you start feeling headaches, fatigue, restlessness, or heart palpitations, that's a warning sign that your blood pressure may be rising rapidly and becoming unstable. In that case, it's best to see your doctor as soon as possible. So, don't let yourself become a prisoner of the numbers. Listen to your body, not just your machine. What truly defines healthy blood pressure isn't a perfect reading. It's when your body feels stable, calm, and energetic, with no sudden spikes or drops. Because in the end, a steady, balanced heart means far more than chasing a beautiful number on the screen. However, there's something very important to keep in mind. If your blood pressure is extremely high, even when you feel completely fine, you need to be extremely careful. Let me emphasize this. Too high blood pressure is never harmless. The danger is that you might feel no pain at all, yet damage is silently happening inside your body, to your heart, brain, and kidneys, every single day. By the time symptoms appear, like intense headaches, chest tightness, or blurred vision, it often means the condition has already worsened, or a serious complication has begun, such as a stroke or heart attack. That's why, if your blood pressure suddenly rises and stays unusually high, you must take it seriously and follow your treatment plan exactly as prescribed. Now let's move on to the next common question. Do blood pressure medications cause side effects? I'm worried that taking them long-term will harm my kidneys or make me feel weak. The truth is, modern blood pressure medications come in many different groups, each with its own mechanism and potential side effects. The majority of people tolerate them very well, and when side effects occur, they are usually mild and manageable, things like slight fatigue or drowsiness. When it comes to your liver and kidneys, the standard medications used today do not cause significant harm at proper therapeutic doses. In fact, untreated high blood pressure itself is the leading cause of kidney failure and heart failure. That means the benefits of medication far outweigh the risks. Even more, some drugs, like the ACE inhibitors, actually protect the kidneys in patients with hypertension or diabetes by reducing protein loss and slowing kidney damage. The key is simple. Follow your doctor's instructions carefully. Never adjust doses on your own, and always keep your doctor informed about how you feel. When you do that, blood pressure medication is not your enemy. It's your body's protection. And now, we've reached the most important part of today's video, the one that truly holds the power to reverse high blood pressure from the root. Because lasting change doesn't come from pills. It comes from your lifestyle. Let's begin with the first and most crucial step, your diet. Eating too much salt causes the body to retain water, putting more pressure on your arteries. Reducing sodium intake has been scientifically proven to lower blood pressure significantly, especially in middle-aged and older adults. To achieve this, limit processed and salty foods like canned products, pickles, sauces, and fast food. Avoid adding extra salt or seasoning powders when cooking. Instead, use herbs and spices like pepper, garlic, lemon, and fresh herbs to bring out flavor naturally. Build your meals around vegetables, fruits, whole grains, low-fat dairy, nuts, and fish, while cutting down on red meat, saturated fat, and sugar. Potassium plays a key role. If you don't have kidney problems, increase your intake through foods like bananas, oranges, spinach, and sweet potatoes. Potassium helps relax blood vessels and counteracts the effects of sodium. Also, choose healthy fats. Replace animal fats or palm oil with olive, sunflower, or canola oil, and eat more fatty fish rich in omega-3s. These unsaturated fats reduce inflammation and protect your heart. Next comes physical activity. A sedentary lifestyle is one of the biggest hidden drivers of hypertension. When you move regularly, your heart grows stronger, your blood vessels become more flexible, and your resting heart rate goes down, all leading to lower blood pressure. Aim for at least 150 minutes of moderate activity per week. That's just 30 minutes a day, 5 days a week. Simple exercises like brisk walking, light cycling, or swimming can make a world of difference. The third key is stress management and mental relaxation. Chronic stress releases cortisol and adrenaline, which constrict blood vessels and raise your pressure silently. To calm your mind, practice meditation or mindful breathing for 5 to 10 minutes daily. Focus on your breath, relax your body, and repeat a positive phrase. You can also try yoga or Tai Chi, both of which blend gentle movement with controlled breathing and mental focus. Listening to soft music, classical, instrumental, or nature sounds also helps slow your heart rate and promote relaxation. Even simple joys like gardening, reading, or sipping tea can reduce stress hormones. Spending time in nature is especially powerful. It helps the mind unwind and supports healthy blood pressure levels. And finally, remember the finishing touches. Maintain a healthy weight, quit smoking, and limit alcohol or stimulants. Every small step counts. Because the goal isn't perfection. It's balance, consistency, and care for your body every single day. When you eat mindfully, move often, and live calmly, your body begins to heal itself. And that's how you turn managing blood pressure into reclaiming your health, naturally and for life. If this video helped you, please share it so more people can protect their hearts naturally. And don't forget to subscribe to True Health Living for more practical, science-based senior health tips, helping you live longer, stronger, and happier every single day.